Oversight Committee. We're here with April to get an update on the homeless oversight and answer any questions or that we might have. So, welcome. Go ahead, come on up.
All right.
You want to give us an update
Yes.
on where we are?
So, should I stand? What should I do?
You can, whatever you feel.
Whatever you want to do.
Oh, you don't want to go to the big table, huh?
No, well, I can't.
Yeah, come on up.
I just didn't know more members will join. So, hello there.
Hello.
Let's see. You all should have a package in front of you. First couple of pages. It's just a repeat of helping everyone to remember what the four investments were: the Low Barrier Housing Collective, Housing First Support Services, the GAP for permanent supportive housing, supportive housing financing, and then the interim housing. The interim housing options. So those are the four. Most of them were signed on October 4th. I think some of the final contracts were not signed until late November, early December as well. So the first one, I guess, is the one that's probably being used the most or utilized the most right now, which is the interim gap housing. We use that to help with our encampment housing surge. Right now, the Salvation Army and the Community Care Fellowship are the two that are providing that interim gap housing. The Salvation Army is at an undisclosed hotel, and CCF, they are actually at 3 locations right now. So you'll see the Salvation Army, that hotel, there's some data there. It says 11 people signed the lease, but that's now actually like 53. By the time we started pulling this information, we got the updated information, but didn't have it in this report for today. But what was startling to me there is 82% have at least 2 disabling conditions. 82% of the people that were living outside Brookmead have at least 2 disabling conditions, and there's 55% that are documented as chronic homeless, and when I do the air quotes, it's just because maybe they have not had someone tracking them along the way for their time.
Now, in chronic, how many years do you have to be chronic?
So there's 3 years with 4 bouts of homelessness within 3 years.
Okay.
Yeah.
Add up to 12 months
Add up to
over
12
the
months.
period of the 3 years.
Yes, thank you.
It's a little complicated.
Or a year continuously.
Yes.
And you have to have a disabling condition.
So, disabling conditions, do you track the kind of disabling conditions? I'm just curious. Because I know some, we've seen in wheelchairs and other areas. Can you give some idea of what?
It's anything from mental health, recovery from drugs and alcohol, domestic violence, physical, HIV and AIDS. I'm sure I'm leaving some out.
Substance use disorder.
So
Track categories, but not like a specific condition beyond HIV and AIDS specifically.
So addictions are disabling considered. Okay.
So if someone had like schizophrenia, for example, it wouldn't say schizophrenia, it would say mental illness. Gotcha.
I'm not using HUD's definitions and guidelines in the database. Now, some of the case managers that enter the information into HMIS may put the actual conditions, but it's on a case-by-case basis. But there's drop-down fields in HMIS that pull these reports and use. Great question there. So let's see, 53 people from Brookmead, 47 rooms are actually at the roadway currently. A couple of really great stories there. I was there the day when most of them moved in, and you go back like 2 weeks later, a lot of them look different. There's one that dyed her hair red, and she said it was something different to be able to wash your hair out and not use the river water. She's actually started putting in 3 applications, so those kind of stories are what
Awesome.
yeah. So.
And I stopped by a few times to meet the social workers there. They were pretty good. They could identify specifically with each Met the security guy, seems to be really on top of things. So I think you guys, from what I've seen so far, it's pretty positive. Saw a few people that seemed to be pretty happy with what they were. They're in their room, so you don't get a chance to really, interact too much with them.
Yeah. And, we still provide meals there with the help of Room in the Inn, and Nashville Food Project was providing meals for a little while. So that's a really great way to be able to engage so that you're able to communicate with them daily. CCF, right now they have 3 sites that are open. You're going to open a 4th site for families and a 5th site for LGBTQ population. And then the 6th site is going to be their High Roads location, and they're doing more interim housing there. So
How much more room do you have at 95 Wallace, at the roadway?
So I don't have that information in front of me, but I can get you that information, yeah.
At 53 moved.
So 53 moved in, and the
rooms.
Salvation Army was already housing people there. So that's, and I didn't want to mix their rapid rehousing numbers with the interim gap housing numbers,
Okay.
but I can get you that report and just report it separately.
Just curious, because as we continue to make progress, it'd be nice to know how much has been used. Are you using the navigation system to know how long they stay, or what alternative places they may go?
Yes, we have our HMIS database, and then we also have a spreadsheet for every individual where we're tracking how many options of housing was available. There was 2 van loads that were, taken over to a housing option that they all chose not to accept, but we want to make sure to track that as well. So.
Okay.
For the Connection Church for LGBTQ plus, where's that located?
I believe it's there, Donaldson.
Donaldson area? And so they're presently doing some work on the building. Do you have an anticipated opening?
I did not speak with HG, but I can get that information. Yeah.
Okay, thank you.
You're welcome. So let's see, those 3 sites right now, I think that another great data point would be the initial investment of ARP funds for CCF. They decided that they could house 70 people, and they've served 93 under the initial investment.
That's great.
Any other data points there that I should highlight? So there's some high needs population, the youth, families, people with pets. So that's why the interim gap housing was really huge. LGBT population. That's why the interim housing was really huge, because it's high needs and we have low shelter bed capacity.
What do you do with the pets over time? Because when I was there, we were taking the pets, and there's a few people that were helping, and we found vet service that were paying for their shots, which was amazing. When I saw the community get back behind that, it was pretty cool. But in the long term, you see a lot of pets. What is the?
There was 2 litters of puppies there.
Oh my gosh!
So.
Yeah, I know.
Beautiful puppies. You need a new puppy with those puppies.
That's Lady Evans said she might consider one.
So Nashville Humane Shelter was able to come, or Society was able to come in to help with those 2 litters of pets. They're going to make sure that they're adopted out.
Okay.
And then we work with them on shots and food and crates. Also Safe Paw.
Okay. Yeah, I didn't realize how many had pets, and they were very committed to the pets, which is, like any of us.
One delayed moving because we were wanting to make sure that the puppies, the mom dog, was able to continue to work with the puppies as long as they were needing that. So, let's see, the gap financing, Mel is not here for this report, but just there's not much that's changed in this report other than I think they were in the review and ranking process.
Thursday there's a meeting to go over the review and ranking piece.
Okay.
Yeah.
But they still can't say how many developers have applied.
No, that's MDHA's policy. I think it will probably all come out on February the 14th. Those that apply, there probably will be a report for those that applied and those that were awarded. They're at their board meeting on February 14th. So nothing changed, no change there. Housing First Support Services, that's the $9 million for support services. That application closes on Monday, the 23rd. So, and I have on purpose not tried to review any applications that's come in at this point, and we will have a ranking review process for those funds as well. The bidders conference was on the 12th of December, and at that point, there was 12 individuals on the calls from 8 different nonprofits.
So you got enough people to bid on this?
And I'm sure that there's been more interest that did not make it to the bidders conference, but we were able to send them the information.
When did you say the deadline to complete?
Monday, the 23rd of January.
How long will you take to review them to get those
So
decided?
we're going to meet with that committee on tomorrow evening and come up with a timeline on what that'll look like.
Just a tiny guess on
And then the final one is the Low-Area Housing Collective, which we were just talking about the U6 All-In new report, and talking about Low-Area Housing Collective and landlord engagement is one of the huge things that USIC is supporting, and saying that HUD is instrumental in. What we're working on is utilizing a new database system. We have a web page that takes a lot of work on the back side. It's kind of an antiquated system where everything lives on an Excel sheet or in a Google Doc, not necessarily forward-facing on the web page. So we're working with a group called Pad Mission, getting 3 different bids. I guess I should say that. We're getting 3 different bids so that we can move forward with a platform that will hold information, and it will be user-friendly so that service providers can use it and landlords can update it without a lot of Excel spreadsheets. Then there is the remaining, so also what we're working on in that department is furniture. There's a lot of social service providers that help to find housing for people and actually give them a key, and may sometimes have to walk away and leave them in an empty apartment. So we want to make sure that there's some furniture. I'll call it furniture voucher for lack of a better word, but it won't be a voucher process. We're going to contract with several low furniture options.
And I talked to Salvation Army too about this, is to let us know what you need. I was able to get the Hotel Association, since I know them pretty well, and they're going to get involved. I actually got one hotel's already got supplies sitting there. I got to remember to tell Salvation Army to go get them. But if you furniture, because these hotels go through these renovations, I've been through a bunch of them. We just throw the stuff out half the time. I mean, it gets to be where if there's a value, we could probably get a lot of that furniture or supplies for you. So then keep in touch with that. Lisa LeClaire is the executive director of the Hotel Association. And I put her in touch with Salvation Army. If you could just reinforce that. I mean, I've been through renovations where we have 300 desks and 200 couches and stuff like that. And those are places we could send them. So I think most hotels would be glad to do some of that.
All right. Thank you for that.
Sure, absolutely. We have resources. I think the important thing is there's resources that are out there that really could add value.
Thank you. And then the very last one for me would be the encampment strategy. We're trying to do a debriefing on Monday, Brookmead call, and a debriefing on the outreach call, which is on Wednesday. But Monday was a holiday, so that didn't happen, but we will have a debriefing call tomorrow. And then taking a little time to do some decompressing of the numbers at the hotels and CCF, as CCF units are coming on board, just making sure that our resources align with the number of people that are in need of housing. And then the next step would be Caldwell Soccer Field, which aligning whatever happens in the debriefing and decompressing conversations. And then also there's a logistics team that's preparing a timeline and resources. We'll do an actual walkthrough with Councilmember Johnston and Parks and Water and OEM and Fire and several other departments, just to, springtime is when that camp is known for flooding, and the floods come in really fast. So we want to make sure that we're on the early part of spring instead of the middle.
Yeah, very good. I have questions, but go around, anybody have questions?
Yeah, I have questions.
Sure.
I have a question. You mentioned that you all are keeping the housing options like in a spreadsheet along with other things. Is it not possible to add extra fields to the HMIS system to keep track of those things? Because it seems like that should be a function of the HMIS system that you should be able to,
Could absolutely do that.
so we didn't have to spend so much time adding. Who actually is providing the support services at the
So
motel?
it's a combination. We have that support team from the Housing NOLA support team that came in. We have that. The Salvation Army is providing support services. Mental Health Co-op is providing support services. A lot of them had I think there was a total of only 12 that were not already connected to a case manager. So the case managers are still following them as well. And several other, we have people that are, if they're wanting recovery services, we have those options as well.
I looked at the contract from NOLA. There was a couple things with that. They're not actually providing support services according per the contract, which wasn't in place last time when you and Stacy implied that contract was in place at the last meeting. It wasn't actually in place. It wasn't in place for several days. But the contract does not say that it's providing support services, so that's why I'm concerned. It said that it was providing oversight of case management and oversight of encampment closures. So
They're providing support services. So it's that when you say oversight of case management, one is we don't want an outside team to come in and tell all the case managers in Nashville who are experts in that field how to do things. So we're working in conjunction with them.
and I did have a question too. I'm not sure what the legality of them working on the ground before that contract was actually executed, because it wasn't executed in place until the 22nd, even though on the 19th at our meeting, you said they were already on the ground. That contract wasn't actually in place, so that's a little bit of a dicey legal question.
And I don't have the exact date that they actually came, but they were providing services the morning of. I saw that contract, but I think the contract had already, the work, I don't know about the signing of it, but the work had started early October. But because of death in families, holidays, that was probably a little bit of the delay. But I can get you the date that they started and then the date that that contract was signed.
I think that's important because we want to make sure that we're actually following Metro, legal in that. Also, last time at the last meeting, you and Stacy talked about that you had outside emergency disaster relief groups, MHED outreach workers, new substance abuse resources, TSA, and all that providing wraparound services. Yet it sounds like you're actually spending a lot of time on the ground and actually providing one-on-one support for some of the residents. You and Stacy were last time talking about providing food, bringing people to mental health services, taking pets, et cetera, et cetera.
So when I say me or we, it's probably MHED and that support team and or the agencies that are working with them. So like tomorrow there is I think the wording probably is what confuses everyone. Like tomorrow there is a document day and everyone was wanting to know who's doing the document day. Is it MHED? Is it the support team? Is it the Salvation Army? And I think for me that shows a good collaboration where nobody's taking ownership or saying it's just me or I. It's more of a team approach.
Okay, I just want to make sure that those resources, we have enough to meet the need as we have them, and if not, that we bring those in place. And I have one final thing. Recently, Carrie Gornick, who works at the Oasis Center, resigned from the Homelessness Planning Commission because she found herself as an agenda item on a meeting between MHID and the Homelessness Planning Commission Executive Committee, where they talked about going to talk to her employer in the private sector because they didn't like how she asked questions in meetings. Carrie resigned as a result, and yet you and Jaha and Director Pratt still met with her private sector employer, I think looking for a reprimand. And I really think that you met on Friday. And
I didn't meet. I'm saying that it wasn't for a reprimand.
well, you apparently said that you thought she was too direct, you did not like her tone of voice, and you thought she asked too many questions about things.
That's not true.
But I really think that is unethical and really an abuse of power as Metro directors. And I think that we really very seriously need to look at that, because that is well above the scope as a public employee of what someone should be doing to a private employer. And I have heard rumblings on the ground that that threat has been made towards other service providers who have been questioning what is going on. And I think that's a pretty serious issue. So I'd like to hear how you respond to that.
Very good. Thank you for the time to respond to that, because majority of that is out of context and not accurate. So, executive committee, I set the agenda. She was nowhere on the agenda for executive committee. Her peers brought her up in that meeting. Her peers started that conversation, and it is recorded. So,
I'd like that recording if I could, please.
I'll just need to make sure to verify Metro policy, but it is recorded.
Oh, they're public meetings.
Yeah, but that recording is not public, so it was not recorded by, anyways. It is recorded, and you will see who brought that conversation up. So it is unfortunate that that was not Metro Homeless Impact Division's goal. During HPC the month before, we realized there was a pause in youth sheltering, which I'm getting calls at 11 o'clock at night, 12 o'clock at night saying, where do I take a youth? And I think that that means that Metro needs to be involved in helping to resolve that. So there's two things that were going on, and one had to do with the pause in sheltering. So we tried to have that conversation, tried to have the conversation outside of the HPC meeting. It was met with discord and words as if the mayor is so involved and wanting to know what's going on, that kind of language. So that's why her supervisor was approached, because she's not over the shelter part from what I hear. She was not over the shelter part of that private sector organization, and that's why we reached out to him. During that conversation, he had already reached out to several other peers in the community, and they had already shared those sentiments. I have notes from my meeting, and my meeting did not say anything, the things that you listed. I didn't say she was too direct.
Do you think it's appropriate for Metro directors to meet with private sector employers?
When there is a breach in a shelter system that I was reporting on, our shelter numbers and our cold weather sheltering, if there is a breach, who else would I go to resolve that?
The Oasis Center is not a Metro facility, so it's not really something that should be a part of Metro's reporting. The Oasis Center had lost a lot of employees at one time and had to shut down the shelter for a short period of time, but that is not a Metro facility, so I'm just wondering why we are getting tangled up with a private facility.
We're entangled. It's unfortunate that you have those type of questions, but we are entangled with a lot of nonprofits and the services that they provide. And if there is a breach in service delivery, I would rather resolve it during the day when the light's on and I have more people to access than my midnight calls from service providers saying, where do I take a youth that's 15? I can't help them at midnight. I can't. So as we, the COC or the HPC, look to help with coordinating, planning, networking, then that is absolutely the place for that conversation to be had.
Well, all other nonprofits providers knew that the Oasis Center had shut down the shelter because of loss of employees. So that wasn't a new thing. That's something that if we have a plan, these kind of questions should be in place so that we know what to do when we have a plan B for those types of things.
So they all did not know, and that's why I was getting calls at midnight from service providers asking, where do I take the youth? They did not know.
I still think it is completely an abuse of power for a Metro director to approach a public sector employee to talk about that employee, not in their position on a public board.
Councilor Porterfield?
I just had a clarifying question for the, just to clarify. So the conversation with the Oasis Center, was it about the employee in question, or was it about the shelter being closed?
It was about the shelter being closed and that the person that was representing them in the community, we did not feel comfortable that we could approach her in that manner.
She had already resigned. She had resigned from the HPC.
I don't understand what your point is.
She had resigned from the HPC. She was no longer
I get that, but
serving
I'm
in that
saying,
capacity.
I don't understand what that is.
I'm sorry I interrupted you, but I wanted to make that clear.
Councilor Porterfield?
Yeah, I know we're
clarify?
over. I know we're over time. I'm just trying to understand the scope of the totality of what happened. So, someone that was serving on this board, or this committee, and you all felt that this person was unapproachable, so you all went to their employer to have a conversation about that person based on their work with the Oasis Center or based on their work on the committee?
Had nothing to do with their work on the committee. It was about, the initial conversation was about the shelter being closed and we need a plan. And the person that represented them, whether it's at shelter committee, wherever it was, the same person was not approachable for us to have that conversation with. And when we tried, I'm not saying that we never tried, right? When we tried to have that conversation several times, it was not met with ease. And it was important for me to share with with her supervisor. We're not the only ones that felt she was unapproachable. The executive committee, other members started that conversation about her behavior, and HUD TA sent a report basically saying, negative things about those behaviors as well. So it was me reaching out to him was about who do we address when it comes to when it comes to youth sheltering, because we hear that you're on pause and her behaviors are concerning. This is not who we can talk to resolve this.
So you were looking for another person to talk to?
Right, that's exactly.
Yeah.
Okay. This probably could carry on a little bit, but if it's okay with you to carry on some more questions.
Can I just make one other point?
Yeah, sure.
The attempts to talk to Ms. Gornick were last February, not recently.
You're right, but I'm not going to chase people around. So that, two conversations here. That was for me to talk to her about her behaviors back then, but to talk to her about cold weather shelter, to talk to her about shelter closing, was not. That was October, September, November, whether it was from me or from Karen Weaver with the mayor's office. So those are two separate issues. February was for her behaviors.
Yeah. Okay, let's get through other questions that might be, Councilor Porterfield, did you have any more? Councilor Evans, I know you had your hand
I was
raised.
just gonna say that I kind of feel like this would be a better conversation to
Right.
bring to the planning council.
Yeah, it sounds like it.
Maybe as an agenda item if there's concerns, rather than put you in the hot seat. Because there's a number of people on the executive committee. So I think that might be a better place to have that conversation.
So maybe that's a good idea, if you wouldn't mind
No, that's
expressing your concerns to them. I think that would be a little bit of a good place to do that. I know, Councilor Allen, did you have some questions?
I think just trying to get my, I apologize for missing, there was an issue that I had raised in traffic and parking and pulled off the agenda, and I didn't want to disappear for it.
You're involved in everything.
Everything. So just in terms of, I see numbers here of how many people you have moved into things, which is great. Are we 50% of the way with people and 50% of the way with the money, or?
No, not nearly 50% with the money. So I would say with the people, that camp location was 100% closed. So with the people, there's over 600 people that experience outdoor homelessness. So I would not say that we're not 50% through. And then with the funds, that we're looking at a dashboard so that you guys will have easy access to that.
Timeline on that?
Yeah, well, I don't have a timeline on it, but it probably can be here within the next month. So
That'd be great.
I think we have the basis for it. We just don't have a lot of data to put in it right now. So instead of putting up, 7, data point with not a lot of data, right? Not
Maybe the second February meeting that we would have, maybe you could give us a
absolutely.
update on that.
Where is the dashboard?
The dashboard's going to live on the mayor's webpage or Nashville.gov. Yeah, and MHEAD's page.
Councilor Allen, did you have other questions?
They could well have been answered while I was in traffic and parking.
We'll keep on going, yes, sir.
She has that notebook with every word for 11 years.
Yes. It's all in here. No, just,
It's a heck of a notebook.
I know. Well, you can see what's happened to it, so.
I feel like I'm under.
Right, so, no,
My
just
file's a lot
questions about
smaller.
the $30 million for, I guess, everything. And this may not affect you, this may be more of an Angie Hubbard question. As interest rates have gone from very low when we started the process to now 7%, I know that's affecting what people can borrow to get into housing. Is that affecting where you're being able to put people, or how much money you're having to spend on each person to get them into housing?
Not so much for that 30 million, that's more of Angie's, but as far as the 50 million, the 25 million for MDHA, that may affect some of their contracts coming in just because, cost and price. I can't speak to that, but for us, I would, MHEAD, it would be more of the fair market value of what HUD, has deemed. It went up this year from last year. And I don't have those numbers, but do you know? Yeah. But it's on HUD's
Gotcha.
webpage. They
Gotcha.
allow fair market value to go up based on, counties.
Gotcha. And we're not watching like the Catalyst Fund money. That doesn't come under our.
No, I don't see that. This is the 3 or 4 purposes for the 50 million. Vice Mayor Schulman asked us to sort of
Gotcha.
keep, and I think it's, you got the planning, you got a lot of others that are doing that similarly. I mean, it came from that area. So I think just on a routine basis, these don't have to be long, but just getting updates, making sure that we follow the money and follow the process.
Gotcha.
Anything else?
And this was recorded, so I'll watch the part that I
Yeah,
missed. So
it's
thank
all
you.
recorded.
Thank you for being here. Thank you. Appreciate it.
Any other questions? If not, we'll just plan on, again, questions by that first the Wednesday before the second meeting at the council. And then we'll do this right after Human Services. Generally, we have almost nothing. So it becomes,
Think positive, Tom.
I've been doing this and I don't get anything to say except vote and it's done. But anyhow, I think this is a good place for this to be where it doesn't interfere and we don't have to bring everybody in on a separate day. I think
Yeah.
that causes a lot of, it's not like we don't already work pretty hard. So if we can just keep this routine going, and I think we appreciate, getting the feedback and maybe a little bit more on the affordable housing component next time would be good. So anything else that you want to pass on?
No, but I just think our entire community is working super hard with the resources that you all were able to award, and happy to see where we are and where we're going.
So you'll be able to help us a little bit on the dashboard next time, and then
Yes, I
I think
will.
that would be good for us to see something physically visible that gives us a sense of direction. I do like the numbers that got into Roadway Inn. It's pretty good, and some of the
They're
teamwork on the
thriving
dogs
there.
and stuff. So thank you,
Thank you.
Thank you.
and the meeting is adjourned. Thanks. Thanks, Scott.
Did you?